However, as frequently happens, the patient seeks desperately another explanation for the pain and dysfunction and wants the problem to be fixed. They want it to be cured. They want it to be taken out. Take it out. Only finding, however, after the laparoscopy that they're unchanged, or even worse. Here again, this is where acceptance needs to be emphasized. If you're constantly seeking other explanations for why you are walking around with classical IBS symptoms, then you're going to be retesting and testing, and you're going to be getting into that cycle of, I don't believe this is what it is. It just feels too bad for it to be a benign condition that's not going to affect my longevity, and I just can't live like this anymore. There's got to be something else going on here. And if you look at the statistics, people who suffer with moderate to severe IBS end up having more surgeries unnecessarily because they're seeking a more definitive treatment that isn't there. So the abdominal pain of IBS can radiate to many different locations, which can confuse the diagnosis. That's one of the problems. Pain is typically periumbilical, around the belly button area, but it can be anywhere. It can be in the left lower quadrant area. And again, this is frequently where diverticulosis is typically found. Diverticulosis is the condition where you have herniated sacs or herniations of the muscle wall, the colon, that form little pouches. And these pouches, of course, can be infected, become infected. That's diverticulitis. And that's pain associated with usually fever. The pain is localized to one spot. The person almost jumps off the bed when you press too hard. There's a definite infectious process going on. That's not IBS. However, the presence of diverticulosis or many diverticula can sometimes cause a condition called PDD, painful diverticular disease, where because there's so much diverticulitis, because there's so many pouches in that segment of the sigmoid colon, the S-shaped portion of the left colon, that you can get a heightened spasms, if you will, in that area that can actually mimic IBS. The treatment, frequently, is an antispasmodic, an IBS medicine, to help calm it down so that people can, again, get on with their lives. So, in patients with a colonoscopy, a negative colonoscopy, a negative CAT scan, where diverticulosis has been identified, and maybe they don't meet Rome criteria, it could be this entity called painful diverticular disease. And frequently, patients are given antibiotics often because in the fear that this may be an infectious process. And again, sometimes it's just spasms of that area. Another area for where abdominal discomfort can occur is the right lower quadrant. That's where the appendix lives. And here, of course, we need to rule out appendicitis, which is fairly well done today with CAT scans and a surgeon examining the patient, but sometimes can be confusing. Blood tests, of course, are very helpful as well to distinguish between an inflammatory process like appendicitis and irritable bowel syndrome, but sometimes it's tricky, and sometimes the patient may end up with surgery and a normal appendix. Another place that the pain can radiate to, and this is so common, is the lower back, the lower mid-back. Remember, the large intestine lies closer to the back, especially the transverse colon, or the colon that basically connects the left colon to the right colon. So again, here's our sigmoid colon with the reticulosis typically are present through this area. Then you have we talked about the splenic flexure. This is the transverse colon, transverse, going across to the right side. This is the hepatic flexure because it's underneath the liver, and then this is the right colon. And this area of the colon here is called the cecum. That's where when we do our colonoscopies, we want to make sure that we get all the way to the cecum to make sure we got all the way around the colon to evaluate for polyps and things like that. But back pain is such a common symptom because that transverse colon sits right back here. And when it goes into spasms, as IBS does, it can cause terrible back pain that's frequently diagnosed as being musculoskeletal. And you may have a disc that is identified on CT or MRI, and you may have other findings that make one consider surgical options to try to get the pain under control. But I have seen patients who have undergone back surgery for back pain and have come back to me saying, you know, I continue to have this back pain despite my surgery, and it's not clear, is this IBS and in some cases it is, because when we treat IBS in these patients, their back pain goes away or improves. And so sometimes, again, a trial of IBS medicines may be a better option prior to surgery if it's not exactly clear that the back pain is due to a significant finding on CAT scan or MRI. It's always important to remember that irritable bowel syndrome is a benign chronic disorder or dysfunction of the colon, not a disease state. It has no effect on longevity, no relationship to cancer. And the idea that severe pain always means a serious underlying disease process is not the case.